The parent consultation training, I'm not sure if any of you are co-supervisors too, but today we're just going to be focusing on parent consultation. So how to run a session, how to build rapport with the family, what to do if you have a difficult family, all of that type of stuff. We have a multi-step process that we would like you guys to follow. You can adapt it to work for you. You know, everyone has their own style of doing things, but we're also going to talk about communication with your supervisor on the case, either the BCBA or the co-sup. We're having discrepancies sometimes between what the supervisor is recommending and what the PC is recommending. So we just want to make sure everybody's on the same page, working towards the same goals, using the same interventions or strategies, just so the parents aren't confused. So the papers that I gave you guys, we have an outline of the presentation today. You can take notes on it. This is for you to take home. The slides don't have all of the information on it, so it's important to pay attention to what I'm saying. I don't like just reading from slides, and there's no point in you guys being here if I'm just going to read from slides. So just try and pay attention. If you have questions, please ask. You can raise your hand. You can interrupt me. It's okay. Sometimes I start rambling, so if you need an answer to something, just let me know. This is our parent education document that is in all of the binders. At the top, we have the goals that you should be working on with the families. You shouldn't be taking data, though, unless they are at the level that they need to be at. Of course, you take baseline and all of that, but if they're not implementing anything on their own, there shouldn't be any data. So that's why we have this section down on the bottom, update and recommendations. So you'll let us know what level you're on, if you're still explaining the strategy or intervention, or if you're role playing, whatever it is. This is really important to keep in the binder because this is your communication with the rest of the team. The supervisor should be reading these and even giving you notes or different things so the communication can stay open and we are all working on the same goals. Okay. This is little paper. It has step 1, step 2, step 3. We're going to practice. I'm going to give you a scenario, and we're just going to kind of go through the steps of how to start with a new client or just a new client for you. They may be new to ABA, they may not be, so just how to build that rapport, pull out key details that you need to know, and the goals that you need to start working on. So it's just kind of like a little cheat sheet for you. If you wanted to keep this, you can. It's just something I made up really quick. You don't have to use it, but it was just for us to practice today. Okay, this form is your ticket out of here. This is about our training. It has the topic, objectives, strategies, all this stuff. So you're gonna, at the end, you're just gonna fill this out. And then you're going to make a copy. You're going to give me the original because it's going into your files, your employee files, and then you take the copy home for your records. I won't sign your timesheet until this is done. Okay? So you'll go make a copy, come back, I'll take this from you, and then sign your timesheet because we have to have these for documentation that you were here. Yeah? Everyone understands?
Yes.
Right. Again, if you have questions, please stop me. Is anybody co-soups here? Does anyone do PC already? A few of you. And are some of you brand new to PC? Okay. So we're probably just going to start from the beginning of it, just so everybody is up to date and everything. Typically what you're going to do is you're going to start with the FBA. The FBA will have parent consultation goals listed inside or in the FBA under the goals section. Typically comes last in the goals section, and that's where you'll start. So you need to review the FBA before you go out to the family. It's really important to do that, because if you just show up and you know nothing about the family, a lot of the times the parents get frustrated because they have to explain themselves again, and for the most part, a lot of them just sat and did an FBA, an assessment with a supervisor, and they've sat for 3 hours talking, and for them to have to re-explain everything sometimes can frustrate them. So it's really important to review that FBA and to make sure that you understand the dynamics of the family before you go in. Please know the family's names. Okay? It's really important. Please know the kiddo's name. It's always important for the parents. Okay. So for this training, we're going to define parent consultation, set up for success with the families, what to do with resistant parents. We have a multi-step process that we would like you guys to follow. We're going to do an example of a case, talk about teamwork, and then any questions that you guys may have. Okay, so parent training is involving parents or caretakers in the child's ABA program. We want you to involve the parents as much as possible, or caretakers. It depends on who the child is with. We want them to be involved as much as possible in the ABA program. It's really important for them to be involved in every aspect. Again, sometimes you have those parents who want to be involved a little too much, so we'll start having to fade back with them being in the program, because we all know that sometimes that can interfere with our programming. But we really want to encourage them to be involved. The goal of ABA is for us to be able to leave and the parents be able to still implement with their child. We don't want to be there forever. So to be able to do that, we need to make sure that the parents are involved. You'll be sharing details about behavioral goals, the reason behind the goals, how to implement. A lot of the times the parents will come to you because they see something in session and they'll ask why they're doing that. So it's important for, hi, come on in. Find just an empty seat anywhere.
Okay, do you want to sign in?
Yeah, actually. Did anyone else sign in? No?
No.
Okay, I'll pass it around and we'll just all sign in. There's one over there. Yeah. So if the parent comes to you like, Shelly is ignoring when my child is tantruming and not helping them, they're just ignoring them, and being able to explain the reasoning behind that, if it is attention-seeking behavior or things like that. It's important for them to know what we're doing and why we're doing it. We want to involve the parents in evaluation of the programs. So a lot of the times when I go out, I ask the parents, how do you feel like things are going? What are your concerns right now? What do you feel like your successes are? And kind of starting at that point. A lot of it is just listening to what the parents need and being able to translate that into what we can do with ABA. You want to be able to observe parents implementing and provide them feedback. Providing them feedback is very important, and that is something that is sometimes forgotten. We need to praise the parents for their successes. If you see a parent implementing priming, give them social praise. Just like the kids like it, the parents like it. They like to know that they're successful. They like to know that they're doing what it is that they need to be doing. And you can make recommendations to parents about behavioral goals. What's important about this is you need to make sure that your recommendations or interventions that you're telling the parent to do is the same as what the supervisor is telling the therapist to do. Some of you may be the therapist and or the therapist and PC on the case. It's still important to talk to the supervisor. Just so everyone's on the same page. And when the supervisor walks in, they know what's going on. A lot of the times if we walk in and we don't understand what you're doing or why you're implementing it, it frustrates the parents because the supervisor is supposed to be the one controlling all the programming and everything like that. Any questions about what parent training is? No? All right, we will move on. Okay, so we have a clinical team. Parents are a part of the ABA clinical team. This is something I tell parents all the time. Just like an IEP meeting at schools, the parents are involved in the team. They're allowed to make suggestions and things like that. It's just like our ABA program. Parents are allowed to make suggestions. You are the professional, so you want to steer them in the right direction and make sure their suggestion is appropriate, to be honest. But you need to make sure that you validate what they're feeling and validate what they would like us to do and just make them feel like they're a part of the team. Let's see. So, the ABA therapist. The therapist is the one who implements the interventions and the strategies with the child. It's important. If any of you are going to be co-soups or anything, this is more, we're going to go over this a little bit more next month, what each role of the person is. I just kind of wanted to do a little overview so you guys kind of knew where your position was as the PC. The supervisor, you may have a BCBA or a co-soup. And they update the programs, they train the staff, they kind of head everything. So any kind of suggestions you have or anything that you want to implement, any interventions, need to go through your supervisor first. Parent consultant, they train the they train the parents on skills and interventions. And communication is the key to success. We all need to communicate. It becomes frustrating for parents if the supervisor comes out and tells them to do something different than the PC. I'm going to repeat this over and over again because this is what I want you guys to get. It's really important that everyone communicates. I've come out on cases before and they'll say, well, the parent consultant said to do this, and it's not the intervention that I would like to be used. Not that it wouldn't be a right intervention, but there may be a reasoning behind why I want to use a different intervention than what they're using. So it's just important that you guys communicate. And that's where the PC data sheet comes into play, is if you write in there what you're doing during PC, the supervisor knows, they can write comments back to you. It's just important to communicate. If you don't feel comfortable writing it in the binder, because sometimes parents go through it, email the supervisor and let them know what it is that you want to do. Okay, so to set up for success with parents, you need to start off with expectations of involvement. A lot of the times, parents say, I don't need PC. And you have to explain to them that it's a part of the entire program. PC is something that the insurance requires, or regional center requires. It's not optional. You need to be mindful of how you speak to the parents. Using words like deficit or low functioning can affect how a parent perceives you. You want to make sure that you're understanding where the parents are coming from. The child is their treasure, it's their pride and joy. And if we're coming in there saying that they have extreme deficits or they're low functioning, all of those terminologies, that it could become overwhelming for the parent and they could start shutting down. You need to use words that are a little bit more appropriate.
What would be a suggestion instead of deficit or low functioning?
So a child that has behavior excesses is one term that I use. Sometimes I'll use like maladaptive behavior. Some parents love that. They think it's, I don't know. You kind of have to gauge with the parent instead of, or even like areas of need. What are the areas of need that your child has, and not the word deficit? We don't typically talk a lot about their functioning level unless a parent specifically asks, and I'll tell them, well, if you really want to know, we can do the CARS, which is a childhood autism rating scale. I think I actually have one with me. And what it is you just go through, and a lot of the times they've already done it with the evaluator who's come out. So it looks like this, and it has sections, and you just level them based on where you think that they are based on that skill. So for one is relating to people. Another one's emotional response, body use, imitation. So there's different skill areas that you go through with the parent, and it will level them based on their ability. So what you do is you score it, and then it will tell you where they fall in the range of the diagnosis. This is something that you can use for parents if they want to know. I would stay away from saying low functioning or anything like that, because it can affect how the parent perceives you and what they're willing to do with you. Because if they're like, well, you think my child's low functioning, then they're just going to be low functioning. So just important to make sure you're not offending parents.
What if the parent thinks their child is high functioning and therefore has very little involvement because they're so sure that their child is high functioning? How do you convince them of otherwise without offending them?
Yeah, so I would just talk to them about where their areas of need are. So for example, you can give them the different areas that we work on: communication, social skills, self-help skills, behaviors. And we'll get more into that a little bit later. And you'll ask them, okay, socially, do you think they have any needs? And start from there. And okay, so you think that he doesn't really socialize with other children, so let's start with that. Let's see if we can get him to initiate play with others. And starting from those types of points. Communication, parents are always really concerned about communication. So that's always a really good spot to start if you feel like the parent is a little bit apprehensive or doesn't think they need PC. Like, okay, well, let's start with communication. Do you think that he or she needs help communicating with you, or for you to understand what they need, and start from that type of point?
Well, I'm a parent of an ASD child, and as a parent, I would say you don't try to convince the parent. As you go through the program, we begin to realize how they're performing, how they're advancing, what areas are still needing to be worked in. So it's not a matter, I don't think, of trying to convince them, okay, you believe your child is high functioning, but all of this data says that they're not, because then you step in areas where you don't, like you were saying, where you won't want to work with the PC or the therapist. You would want someone who will get you and understand.
Is more sensitive.
Yeah, and see that you're going through the process as your child is.
Yeah, you always start with them being successful. Just like we do with kiddos. We want them to be successful. That's why, like, when we're teaching manding, we start with one word, because that is more attainable, or even, like an utterance. Sometimes we'll just start with like we just want them to make an utterance to get what it is that they need. That's because they'll be more successful with that than a 5-word response. And sometimes parents need a little bit more explanation with the reasoning behind that. A lot of the times they get excited if they hear that one word, so then they're like, okay, let's move to 5. And it's like, well, no. and you can show them the data, which is, a lot of parents are really receptive to the data. Okay, well, let's look at Manding for one word. He's at 50%. We really want him to be at 80% before we move on, because his frustration level will go up if we move on too fast. A lot of the times the parents just need that explanation. And we're all the same way. Like, if we get an explanation that satisfies us, we're more willing to participate. Making sure that the parents are successful is, really important. You don't want to, again, I'll get into this a little bit more later on. You don't want to start out with extinction with a brand new parent to ABA. It's just not going to work. Extinction is hard for therapists, let alone parents who are with the child, 24 hours a day. And, so you just want to start in areas that they're successful in. And when the parents start seeing success, They get so excited and they're willing to participate more. They just need to know that there is success. So, professional boundaries. It is very, very, very important to keep your professional boundaries. You cannot babysit. Okay? If they ask you to come and help them with something outside of your scope of practice, err on the side of caution. Do not do it. Okay? A lot of the times, parents see us as part of their family. I get it all the time. You're like a sister. You're like, and it's very sweet, and it's good because you have that relationship with them and they trust you. But you, as the professional, need to keep those boundaries. It's not the parent's responsibility to keep those boundaries. It's you. You need to be able to shut it down if it becomes inappropriate. Now you need to do it nicely. You can always say, if they invite you to come out to dinner with them one night, you can say, oh, I have a family event. Sorry, I can't go. Or, it's against our policy. I really can't come out to dinner with you. They invite you to the movies. Oh, I'm busy. Sorry. You got to make sure you keep those boundaries without offending them. Mm-hmm. We deal with a lot of different cultures. Some cultures feel like it's when they offer you food or things like that and you say no, it offends them. So you need to be aware of the culture that you're walking into. You need to be culturally responsive to them, and be aware of how they're reacting to what you're doing. If you say no and you look at their face and there's an issue, explain to them what it is your reasoning behind it. And a lot of the times they're more open to it. Be consistent with parents. If you tell a parent you are going to be there, please be there. Make sure what you are telling them is consistent. So if you show up one day and you tell them, okay, we're going to be working on pre-mac. And then the next time you come, okay, we're working on priming. A lot of the times it becomes a little too much for them. You need to make sure that they're successful and be consistent in what you are teaching them. You don't want to jump around too much. Is it really all that important that they know the definition of priming? Probably not, but if they can implement it, great. That's what we're looking for. We're looking for the implementation and not so much of that they can define the different terms of ABA. Ask open-ended questions. So ask for examples. Don't let them stop at just a yes or no. If you ask, what happened over the weekend, is a lot more, you'll get a lot more information than if you were like, did you have a good weekend? And they just say yes. You have to make sure that they're able to explain to you situations that are happening in the home, because that's what PC is for. Okay, this situation happened over the weekend. What should I have done? Or did I do what I was supposed to do? And talking about those scenarios. We shape behavior of parents by using the same strategies that we use for children. So we start off where they are successful and we shape their behavior to be more successful. And then be sensitive to the unique cultural context of each family. If you are walking into a culture in a family that you're unfamiliar with, Google. It's amazing. It will give you a lot, and some of it might not be true, but at least you'll walk in with more knowledge than if you just didn't know. Reinforcement strengthens behavior. We all know this, ABA. Reinforcement is amazing. We need to reinforce parents. It's important that we increase the behaviors that we want from parents, just like we increase the behaviors we want from children. Okay. Resistant parents to participate. This is something you will run into throughout your whole career as a PC. Don't judge, be compassionate. You need to know that this is their life. They have they want their child to be successful. They want their child to learn. Sometimes it's just hard for them to open up. And you don't know what is going on outside of ABA. There could be environmental variables that are confounding it. So, for example, you could have a family that's going through divorce. That's going to dramatically affect the parents. A parent could be going through depression. You have to be aware of those things and realize that we all have things outside of what we can control. A parent may have just lost their job. A parent could have been out of job for 2 years. So you just have to be aware of those things, and that's why you build rapport with the family. So they're willing to discuss with you the issues that they're having and those variables that are limiting their ability to succeed in ABA. Always explain why their involvement is critical. This is something you will talk about with them almost every session. You know, I'm so happy that you're participating. This is great for your child. They're succeeding. Let's look at the data. See, you've been doing this, this, and this, and look, his tantrums have been going down. You know, and involving them as much as possible. They love to hear success. So at any point that they're having success, praise them for it and document it for them so they know. Start with areas of need that are important to them. If the area of need is important, they're more willing to implement. So this means if you walk in and, you know, the parent really, really, really wants to teach their child how to ride a bike, wants them to learn how to ride their bike, start with that. You know, let them be successful. Let them see their child succeed at riding a bike. You can implement other goals with that. So if the child doesn't like riding their bike, use a pre-mac. You know, first ride your bike for 2 minutes, then we can go play bubbles. You can implement strategies in an area that the parent wants to work on. Now, if it's an area that we don't focus on or an area that's out of our scope, you can always tell them that. And you can let them know other areas that you could work on. But a lot of the times, I mean, they don't typically go outside of what it is that we can work on, because we can work on a lot of stuff. We can work on OT, we can work on speech, we can PT, there's things that we can do. So it's just important to start off where they see a need. Eating is always a really big thing with parents. If that is where they're like, I need help with my child eating, do eating programs with them. You can implement interventions that are in the FBA, so like priming, pre-mac, all of that type of stuff. You can implement with the parent. You can talk about functions of behavior while they're eating. If they're throwing the food on the floor, ask them, what do you think the function of that is? If they can respond escape, okay, so let's talk about different ways that we can keep them, or we could have them request escape appropriately. So there's ways you can implement these strategies into what it is that they want to work on. Start with something they will be successful at. Probably not extinction as the first strategy. Be aware of what their skill level is. If you are having a parent that's brand new to ABA, please make sure you start off with the easier types of strategies. Priming, using a timer, pre-mac, providing choices. Providing choices is one of the easiest ones for parents to kind of grasp. So start with those before you start teaching them like differential reinforcement and, you know, all of that kind of stuff. That gets really confusing for them. All the different DRs, DRO, DRA, DRI, DRL, they shut down. So focus on easy things first.
Okay, so I'm going to interrupt.
Go ahead.
So the case that we have together that's a bit extreme, having a resistant parent with a case of something that is very important to them, potty training.
Yeah.
And we know for a fact that it's only being done when the therapist is there. and as soon as the therapist leaves, they put him in a diaper, right? So how do you implement the parent to work on it when we know for a fact that it doesn't get worked on? So how do you do that?
You just kind of accept that you can't control what happens when you're outside of the home.
Okay.
So you can set them up for success, giving them a schedule, right?
Okay.
We put kids on schedules all the time. Every 30 minutes, take your child to the bathroom.
Okay.
Do not put diapers on. And you can give them that feedback, and then let them know, like, okay, we've been working on potty training for 9 months now, and while we're here, he's not having any accidents. But when we leave, you've been reporting that he's having accidents. So let's talk about why you think he's having accidents. Let's start there.
So just be kind of a support rather than getting frustrated and giving up.
Yeah.
Okay.
Parents know if you're frustrated. And if you come in there and you're like, well, you're not doing this, no, and they're just like, well, they're not going to listen to you.
Yeah.
Just like when we're with kids and we tell them what they can do, not what they can't do.
Okay.
You've got to be able to give them positive feedback. So, okay, he's having an accident. Let's time it. We leave. What time is he having an accident by? 45 minutes? Okay, take him to the bathroom every 35 minutes. And giving them those schedules. If you come in, a lot of the times I'll have parents track.
Okay, so
when it's
kind
happening.
of give them a homework type?
Yeah.
Okay.
Do they always use it? No. But you're giving them the resource.
Okay.
And a lot of the times, eventually, they'll start doing it. Sometimes it just takes them a little bit longer. If you have a parent that is just unwilling to participate, ask them, like, okay, once a week during session, I want you to be able to take him to the bathroom by yourself. Set them up to where it's something that they can do. If you ask him to do it every single session, he's probably not going to do it. So every week, 1 day a week, I want you to take him to the bathroom 1 time while we're here. And then once he's doing that consistently, okay, 2 times a week while I'm here, I want you to take him to the bathroom. So you just set them up to where they're successful and it doesn't seem so overwhelming for them. Again, doesn't always work, so you just change your strategy of what you're using and you try something different with the parents. I want you guys to just be aware of how the parents are feeling with us coming into their home. We're a stranger coming into their home, telling them how to raise their child. That is what they're perceiving us as. So you just need to be really sensitive to that and know that it's hard for them to trust a stranger. So that's why it's so important to build rapport with them. And rapport building is throughout your entire experience with them. Sometimes I've told therapists before when behavior starts spiking with some of the kids, I'll tell them, well, take a couple sessions and build rapport again. And once you have that rapport again, then start implementing the interventions. And a lot of the times that helps. So just making sure that you have that relationship with the parent. All right, so we will move on. Multi-step process. So this is kind of what I follow if I'm doing PC. You can always tweak it to fit you. Everybody does things a little bit differently, but this is basically the steps that we would like you to do. So identifying the strengths and needs of the family and child, selecting goals, develop intervention plan, train parents to apply the intervention plan, implement the intervention, and monitor progress. Okay, so what are areas of need or of strengths and needs of the family? Always start out with strengths. It is the easiest part or easiest way to get parents to start talking. You conduct interviews and observations of the child and parent together. This is everything that you do as a PC. It's something that you want to do when you first start with a family. You can always use the FBA as a resource, It's always great to come in knowing what the evaluator saw before you walk into the home, and then you observing will either validate or you're like, that maybe not. So you have to realize that the evaluators are there twice for 2 hours at most. So it's sometimes the little picture they get may not be the entire picture that you need. So interview the parents, do observations, a great way to build rapport with the family. What are the routines of the family? What are the strengths of the child? What are concerns or needs regarding the child? What behaviors impact the family functioning? And then look at the parent-child interactions. How involved is the parent with the child? Is the parent too involved, which that is something that happens, or is the parent not really involved enough? And being able to gauge that with your observations. Let's see. You can always ask to see the interactions that were identified in the FBA from the parents. So sometimes the parents will let us know, like, every time he takes a bath, he tantrums. So come at that time. Come out of the time that he's going to be taking a bath and see it. You are a lot more able to actually like see the dynamic in the situation rather than the parent reporting it. Okay. Wow, that's really small.
Yeah, it's really small in here.
Oh yeah. Okay, step 2, selecting goals. I cannot see that far, so I'm gonna read from here.
Do you want me to read it?
I got it right there. I think so. Find out from the parents what skill areas are the most concerning for them. So go through the list: behaviors, communication, social skills, self-help skills, self-direction, motor development. These are all skill areas that we can work on with the parent. So ask them, what are some of the behaviors that you see your child doing that are bothering you? If they can't come up with any, give them some examples. But typically if they're asking for ABA, there's behaviors and they can come up with them. I think I've only done one FBA where the parent was like, no, my kid doesn't have any behaviors. And it's like, oh, then why are we here? So, asking them questions about it. And when they say, my child tantrums, ask them to describe what a tantrum looks like. If they're able to verbalize what they're seeing, it will help you be able to implement an intervention for it. Communication. You can ask about their speech, how many words can they use, things like that. You want to choose goals that will have a positive impact and not cause additional stress. So if you feel like a parent's just not going to be able to implement a certain intervention or a certain strategy, don't use that one. If they are not going to be able to do it when you're not there, just don't use it. There's been research done that interventions that are inconsistent can actually increase behaviors, and it makes it harder for those behaviors to go down. So if you know that the parent is not going to be able to use extinction, give them other strategies. Don't tell them you have to use extinction if you know they can't do it. Use your professional opinion. You are the expert in the field, so make sure that you're just giving them the right information, the right strategies to use. Yeah. So the FBA is always a good starting point. So if you sit down with the parent and you're like, okay, what are your communication needs with your child? And they can't come up with any. Okay, well, when the evaluator came out, you described that your child screams when they want a cookie. And that normally will start the conversation. Sometimes they just don't want to talk about it, or they just need that little push in the right direction. This is still step 2. So in each skill area, list the needs of the child. So for example, behaviors, they tantrum, communication, requesting wants. And that's kind of where this little cheat sheet type thing I made may come in handy for you. So like selecting goals. So step 2, selecting goals. You can identify the skill area or behavior. So say the child tantrums. So what does it look like? Have them describe it to you, and you can write it down. What do I want my child to be able to do other than tantrum? What do I want them to do? And when can I work on this? So coming up with those family routines that they can work on it with. We want them to be able to generalize to other routines, but always start out with one. And demonstrate it with them with that one routine, and then you can start talking to them about using it with other routines as well. It's imperative to include the family in working on areas of need. So if we come in and we're working on potty training, and the kiddo's having all this success with us while we're there for 3 hours a day, but we leave and the parent isn't potty training, it's not generalizing, it's not helping the parents at all. It's not teaching them any skills. So that's why we want the parents to be involved. Is so when we leave, that's what they can implement. If the parents do not find the area of need important, they will not implement it. So if you're, talking to a parent about self-help skills, and they're like, oh, it's okay. He's 8, I can dress him. And you start talking to them about, okay, when he's 17, do you want to still have to dress him? Oh, it's not that big of a deal. You kind of have to start off where the needs of the parents are. You can't be like, no, so he needs to be able to put his pants on by himself. The parents can be like, I don't care. So you need to start off where they feel they need the most support in. You can always continue to talk to them about self-help skills and continue to be like, when he's 17, you want him to be able to put his pants on himself. So, that's something we need to start thinking about. Let me know when you're ready, and things like that. So just make sure that it's important to them. Motivation is the key to parent involvement. So if the parents are motivated, they are more willing to participate. And a lot of the times motivation comes from success. So if they feel successful, they're more willing to implement. Parents love when their kids start making progress. So, you'll have the most difficult, resistant parent, and they'll start seeing progress, and then they'll start talking about it. Like, oh, he did this today. Oh, she did that today. And that's success for them. And then they'll be more willing to implement more of your interventions or more of your strategies. Next one, selecting goals. We're still there on step 2. Prioritize goals. If it's a safety concern, that is something you need to work on immediately. If the kiddo is running out into the middle of the street while they are going on a family walk, start with that. Make it a controlled environment and all of that, and make sure that the child can be safe. But that is something that's more important than putting on his t-shirt. We want him to be safe first. Does it cause disruption in the home? Would the new skill increase interactions? Would the new skill increase access to the community? Select goals that will result in the greatest impact on the family and child. If you feel like the parent wants to work on something that's out of our scope, this is a list you can give them and like, okay, where does it fall into this list? For example, like I have a parent, the kiddo's 3 and she wants him to color within the lines. That's, I don't know why, that's her big concern. And a lot of it comes from culture and things like that. So talking to her about, where, like, is that really a skill that we need to work on with a 3-year-old? And describing to her, like, okay, a typical 3-year-old Or even in preschool, you're not going to see any kiddo coloring within the lines. You're just going to see scribbling. Or them being able to spell out their name and write their name when they're 3. Like, that's not really something that we need to work on right now. I know that's a concern of yours, so we'll put it on the list, but let's work on him being able to use 2-word nouns. I know you really want him to be able to tell you what he means, so let's start there first. So you got to make sure that it's something that is socially appropriate, right? Okay. Step 3, define intervention plans. Okay, so if you're going to be teaching the parent how to use Premac, you need to explain to them how to use Premac, okay? Giving them scenarios, giving them how to implement. You want to introduce the protocols. You want to walk the parents through the protocol, selecting a tangible routine. So, for example, parents want to work on eating, and you decided with the supervisor you're going to use Premac to get the child to eat. You're going to talk to the parent about the reasoning behind it, what you're going to be using as a reinforcer. You're going to go through the whole list with them so they understand why it is you're doing what you're doing. You're going to talk to them about, we want them to be able to eat an apple, right? But they don't like apples. But we know that they like pudding. So we're going to take off a little piece of the apple. And we're going to tell them, first apple, then pudding. So they even just put it to their lips. You're going to give them a little bit of the pudding. And let them know that we're going to fade that back to where we're not going to be feeding him pudding all the time. But that eventually he'll start eating the apple, and then he won't need the pudding anymore. So you need to explain to them the reasoning behind the Premac, why we're using Premac. You want to prompt parents to come up with ideas and provide ideas only as necessary. So ask them what it is that they think they should do, right? This comes more with more experience. You can always ask parents when you first start off with ABA what it is that they think they should do. But a lot of the times it helps when they've been in PC for a while and they know some of the different strategies. So if you've taught them 4 different strategies, you could ask them, okay, which one would you use for this scenario? And let them describe it for you. And then you want to review the protocol with them. So make sure that they're understanding each step, why you're doing it. Again, if they understand it more and they're more on board, they're more willing to implement when you're not there. So make sure you discuss it with the supervisor. We want to work together. So some supervisors may not like using Premac principle for mealtime. Some of them have done research on other strategies, and that's the strategy they want you to use. That's why it's important that you're communicating with the supervisor, so you can both be on the same page with the intervention and everything. Okay. You want to model the strategy with the parents through role play, where you can be the child, the parent can be the parent, or the parent can be the child, and you can be the parent. This is always the parents are always a little apprehensive with role playing. So you kind of have to make it fun. I mean, I don't know. I understand it's not always fun role playing, so just be aware of how they're feeling in the moment, and don't make it so serious where they're intimidated. You want to allow the parents to implement the strategy and provide feedback. So they're implementing the strategy with you, not with the child yet. And you're giving them feedback with how they're using it with you. You can demonstrate it during natural or contrived routines. So a natural routine would be, it's bedtime and they have to brush their teeth, right? Or a contrived routine would be, in the middle of the day at 2, you're working on them brushing their teeth. It's not a part of their natural routine. And you can demonstrate it with the child. So the parent watches you implement the strategy with the child so they can see it being implemented with their own child. You can always watch like YouTube videos and things like that, but every child is a little different. They don't all respond the exact same way. So it's important for them to see the strategy being used with their child. If you come during a one-on-one session, which I highly recommend to do at least every couple months, you can point out times that the therapist is using the strategy. Oh, look, she just used priming. Or, oh, look, she just followed through. And making sure that you're showing them when it's being used. You talk through the process as you're modeling. So I'm going to use Premac right now to get him to brush his teeth for 10 seconds. So I'm going to show him first toothbrush, then Ninja Turtle or whatever it is that they're working for. So, and then you count 1, 2, you count to 10, and then you show them, okay, I'm giving them the reinforcement. So you want them to see the steps and you want to be describing it while you're doing it. Debrief and check in with parents to ensure that they understand the use of the strategy. So after you're done with the routine or after you're done with the role play, check in and be like, okay, so what did we do today? Like, let's talk about Premac. How did we use it? What do we need to implement it? We need a reinforcer. We can't just, tell them if the then isn't a reinforcer for them, they're not going to be able to do it, right? They're not going to want to do the non-preferred. So you just want to make sure that they are completely solid in their understanding of what the intervention or strategy is that you're using. Okay, now it's time to train the parents. This is when the parents implement the strategy with you giving them feedback. So they're implementing it with the child now. And you're going to be providing them feedback throughout the whole process. So first what you're going to do is you're going to check in when you get there. You're going to clarify what the strategy is that you want the parent to use, and you're going to revisit previous strategies discussed. So if you're teaching them, or you're reviewing 3 different strategies or things like that, you want to review them consistently with the parent. You're going to check for comprehension. You're going to give them scenarios and see if the parent can come up with ways to implement the strategy. You're going to answer questions from parents. So a lot of the times the parents will be like, oh, you know what just happened last night? And they'll give you a scenario. And you're like, okay, so what do you think you should have done at that point? Or if they tell you what it is that they did, okay, do you feel successful in that? Do you feel like it worked? And giving them that feedback of their scenarios when we're not here. More than 80% of the time when I walk into a parent's home, they're like, oh, I need to tell you what happened last night. Or, oh, I need to tell you what happened over the weekend, which is good. You want them to be able to confide in you, and you need to validate that. Don't tell them like, okay, yeah, we'll talk about it in a minute. If they want to talk to you, sit down and talk to them. And then active feedback. So the parent is implementing Premac with the child. You are going to be talking directly to the parent. You are not going to be talking to the child. So if the child is refusing to eat the apple, you're going to tell the parent, okay, use Premac. Tell him, first apple, then pudding. And the parent will say to the child, first apple, then pudding. So you're basically talking to the parent as if the child's not even there. And you're giving them that feedback. Or if they're being successful, you're going to give them that feedback right then. I like how you stated first then. Great job using Premac. Good job not getting upset that he threw the apple on the ground. Nice presenting another piece of apple. Like you've got to give them each step that they do that they're successful at, give them praise for it. If they're struggling, tell them what to do. Don't use don't. So if they're sitting there and they're getting frustrated, don't say to them, don't get frustrated. Tell them what to say. Remember, we're using Premac in a calm, concise voice. Say first apple, then pudding. And giving them that feedback, a lot of the times they'll be able to take a deep breath and then they'll be able to do it again. Or tell them, okay, take a deep breath. It's okay. It's not going to be successful every single time. Let's try it again. And presenting it again.
So we don't say don't get frustrated?
I wouldn't, because, and it kind of depends on the parent, but a lot of the times the parent will escalate because they know that they're frustrated at that point.
So you say, remember.
Right. Let's stay calm, or let's take a deep breath and do it with them, just like we do with the kiddos when we're teaching them coping skills. Okay, let's try it again. First this, then that. And just having them stay calm. If you feel like they're just getting more and more escalated in the situation, just, use your calm voice and tell them, okay, do you feel like you need a break right now?
To the parent.
Yeah, just like we do to the kids. Honestly, that's what you do. Do you need a break right now? Yes, I need a break. Okay.
It's the same language that you would use with a child.
Yeah. Mm-hmm. It is. I wouldn't use ABA term, ABA speech with them. You make it a little bit more natural. But if you see them and they're just they're sweating, their face is red, and they're just and you're like, do you need a break? Validate how they're feeling. But don't tell them, don't get frustrated. And let them know, okay, so it's not going to be successful every time. The eating program is really, really hard to do, and it's very time consuming, and it's baby steps. We just want him to, a lot of the times I'll start out with them just kissing the food. So we just want him to kiss it. It's okay if he doesn't put it in his mouth. And then we want him to touch it with their tongue. It's okay. If he just kisses it, just give them a little bit of reinforcement. And just walking them through it and making them feel like it's okay that it's not working, or it's okay that they're getting frustrated. I just try and not use the negative connotations to things. You want to make sure that it's positive for the parent, and let them know it's okay if you need a break. We all need breaks. And it's, it can be stressful, and it's okay. So, if you feel like the parent is getting super, super frustrated during the training, go back a step. Have them role play with you again. Have them observe you do it. So you have to gauge with the parents. It's okay to go back. It's okay to sit down and okay, let's talk about pre-mac again. Let's talk about priming again. And going back and starting from the beginning, and then working them up to being able to do it on their own. So, just like what we do with kids, to be honest. If we get to a point where we're they're not being successful at this point, let's go back a step and let's try it again. And that's okay, If we mess up on something, we redo it. So, so during step 4, you want to provide that feedback throughout the whole routine. So you don't wait till the end. You don't just sit there and stare at them and then at the end be like, that wasn't successful. You need to give them the feedback right away for step 4. So after the routine that you're working on, you debrief. You engage the parent in a discussion. Highlight successes, identify the needs, generate a plan to implement. So, I don't know if the way that, so when I'm providing feedback to people, I always start out with a success. You are doing awesome in this and this. What I'd like to see you work on is this, or what we need to work on is this. A lot of the times when you say we, they don't feel so attacked. You need to do this, or you need to do that. We need to come up with an idea to help with his eloping into the street, and involving them and letting them know that it's an area of need, but it's not so much of an attack on them. And then generate a plan to implement. So they are successful at step 4. They can implement it with you, giving them feedback as it's happening. So then you're going to tell them, okay, you are doing awesome with me giving you feedback right away. Next time, I want to see you implement it with me just watching, and at the end, I will provide you feedback. And that is at the point where you will start taking data on the parents. I would tell parents that you're taking data on them. They do not like to look in the binder and see data on themselves and not realize what is going on. So please let them know at the last step you will be taking data. Okay. Let's get through the last step and then we'll take a break. Okay. So step 5, implement intervention independently. So you're going to allow parents to implement the intervention on their own. You're going to take data. So on this sheet, you will write the goal, and you will take data just like we take data with kids. And then you can write a little note, okay? So if you're using the pre-MAC principle, you will take data every time they use first then. Every single time, okay? And see how they are successful with it. So you do that, say, for 2 weeks during mealtime, and they are getting 80%. Then you'll move it to another area of need. The bathroom routine, using pre-MAC during bathroom routine. You can use it in different scenarios, but you're going to be taking data on it while they're doing it. And you're going to tell them, I'm going to take data just like I take data with your child. And then at the end, we will sit down and we'll discuss, and I'll let you know where you're at percentage-wise. You'll have to look at the goal. Sometimes it'll say 90% for it to be mastered. Sometimes it's 80%. For the most part, it's 80%, but every once in a while, I'll get an assessment or an FBA, and it'll say 90. So you just have to be aware of what it is that it says. And let them know that this isn't a judgment on them. You can always tell them, it's just a part of my job, and I need to make sure that it's in your report because the insurance requires it. And you can tell them, we will discuss afterwards. And you can go through it. A lot of parents can either be intimidated by this or they love it because it's motivational for them. So it's just the type of parent that you have. If you have a parent that has like testing anxiety, don't have this paper out on a clipboard checking it while they're doing what it is that they're doing. Okay? It's intimidating for them. So, get a little piece of scratch paper and just, you can do your shorthand data taking right then. So, but don't make it so intimidating where they're like looking at you as you're taking data. This experience needs to be positive for the parent. We do not want it to be negative. Okay. Uh-oh. What happened? Did I do something wrong? Oh, I think I was on the wrong page. Okay. So you're going to implement the intervention independently, use a data sheet, and you're going to keep the documentation in the binder so we can see it. If you have a parent who doesn't like having it in the binder or anything, just let the supervisor know and keep it in your own binder that you take with you, but update the supervisor as you're going. As a PC, you will be writing for progress report time, you will be writing summaries. So make sure you're documenting everything, because if a supervisor says, hey, in 2 weeks, I need your PC notes or your PC summary, and you're like, I don't have any, they're going to be a little frustrated with you. So just make sure you're documenting.
How often do you need a summary? Every month or?
Progress reports are due, depending on the case, every 3 to 6 months. So, I mean, if I was doing PC, I would update the supervisor every month. I think that would be awesome. And I think it would help the supervisor out a lot, and it would help with the communication. So, I don't know. If you can get out there one time when the supervisor's out there, amazing. So, you want to just be with the team. A lot of times what ends up happening is the PC only comes out by themselves, and they're separated from the rest of the team because the supervisor and therapist are communicating, but the PC isn't there, and then it just gets really convoluted. So if you can get out there during one-on-one sessions and things like that, I wouldn't do every session during one-on-one sessions, and even like on regional center cases, the supervisor and PC cannot be out there at the same time. So you just have to make sure that you're communicating with the supervisor, so you're not showing up at the same time for PC while the supervisor's there. I don't know why they won't let you. That's just
It's double billing.
Yeah.
You can only go out there when there's the one-on-one for the parent and the PC.
The parents requested that, or
Well, because this parent,
Yeah.
she has therapies for other children.
okay,
And
that happens. I would
only been able to go out during one-on-one.
yeah. That's fine. I would just ask the therapist if you can run things with the parent every, I don't know, like 20 minutes. Like if you're in the like training part where you would be like, okay, can you show us the pre-mac, and showing them how to do it. And then if the parents are implementing on their own at that point, you would tell the therapist, like, okay, can we let mom do this? I've had that happen before. When I was one-on-one and the PC would come, they would ask me to step back and let the parent run things, which is fine. That happens a lot. Like if there's multiple kids getting therapy and everything, it just gets overwhelming for the parents. So, okay. All right. So this is an example for us to practice. So you'll need your little
cheat sheet.
Yeah, thanks. The word. So your first step is identifying areas of strength and need. So I'll read this to you, and then we'll kind of go through what you think an area of strength and areas of need are. So Jamie is a 3-year-old girl who lives with her mother and older brother. Parents recently separated, and the father is currently living outside of the home. Her mother and father are currently working on a co-parenting plan. However, at this point, her mother is the only one who will be participating in Jamie's services. Jamie is able to mimic some sounds, however, generally grunts, screams, and points to things that she needs. Her mother is concerned that Jamie's tantrums could be related to her lack of communication. Jamie's mother is extremely involved in Jamie's treatment and is eager to learn ABA strategies. She does well with priming Jamie of what will be happening throughout the day. So, this may be something that you would see in like an FBA, like a description like this. So what you could do is you could pull out the areas of strength and the areas of needs for the family. So can someone, well, go ahead. You guys can look at it for a minute, and then I'll ask you guys if you can pull some out.
You want us to start writing already, or just wait?
Yeah, you can write. Yeah.
Sure.
Does the father have visitation rights? Like, are they going to be? Is he going to see the child, or is it only the mom?
They're working on co-parenting, but as of this point, mom's the only one participating in the services. Yeah.
Okay.
A lot of the times, you guys will find this happening in homes that they're separating at this point, where only one parent will be involved, and they're working on the other parent being more involved. But it happens pretty often.
Or with grandparents too.
Yes,
Oh, yeah.
that's always fun.
Mm-hmm. Personal experience, it's always fun.
Yeah. Grandparents are a whole other
Ball game now.
right.
Yeah.
We'll have to have a training just on grandparents. It's harder to convince a grandparent to do something than it is to convince a parent. A lot harder.
Well, you know, the irony of all, my son's now 7.5. He was diagnosed at 20 months, and my dad and my mom have been pretty accepting, and they go with it. My mom was also involved in the ABA.
Okay.
But just a few weeks ago, my dad was looking at my boy, and he was saying, you should take him to be wanted to get assessed again. You have really good doctors. I don't think he's autistic. And I'm like, all right.
Yeah.
Go ahead and take him.
Yeah. You can take him.
It's like a pride thing too,
Yeah.
kind of, right? Yeah. Because I've had a lot of parents that say that, like they want to get them reassessed or whatever, but that's just because they just don't want it, you know?
Yeah.
Yeah. Yeah.
And I would
It's like
never
they're so proud of
don't
their
ever
child.
discourage it.
Right.
Yeah, if they want to get their child reevaluated, don't discourage it. Just like, okay, like that's something you can always do. You know, I have a lot of parents they will get the diagnosis at like 2 years old or younger, and they'll say like, you know, they'll ask about losing the diagnosis and things like that, and I always tell them you can always get reevaluated. That is always an option for you. Don't you know, you don't have to get into the fact that some kiddos may lose the diagnosis or they may I'm blanking on the term right now. Recover. Sometimes they'll say they're in recovery. But you can tell them, you know, you can always be reassessed. You can always find a doctor to reassess. So. Okay, so we're just doing the first one, guys. We'll do the rest in a minute. Okay, so can someone tell me an area of strength for the parents or the child?
Yeah.
Yeah.
Jamie's mom wants to learn,
Mhm.
which is good because she already has that motivation.
Right. Mm-hmm.
And she's already priming.
Yeah.
Jamie's, yeah, she's mimicking. Mm-hmm.
She's able to point.
Yeah, she's able to point, and mom is already priming. Those are all important things to point out to the parent. A lot of the times the parents don't realize that pointing is a form of communication. Well, a tantrum is a form of communication, but pointing is a more appropriate way of communicating. So let's start there. You tell parents, let's start there. If she's pointing 20% of the time, we can reinforce it to where she's pointing 80% of the time, and then we can start working more on verbalizing. You know, there's a starting point for you. Always start where the child can be successful. If the child doesn't have any words, you're probably not going to get Play-Doh from them. They're not going to be saying Play-Doh. So start where the child can be successful. Any areas of need?
Like one word, being able to say a full word, one word manding.
One word manding.
Father involvement.
Yeah, father involvement. That's an area of need. It really is. That can also be
A barrier.
a barrier. Because if Jamie's going to dad on the weekends and then coming back, we could be starting all over again on Mondays. And you can explain that to mom in a more appropriate way, where like it happens a couple weeks and mom's like, every time they come home on Monday, she's just tantruming, and then we're starting all over, and talk to her about, well, if it's not being implemented in the home on the weekends, she's relearning that she needs to scream and cry and grunt for the items again. So we're reteaching her every single time. So what can we do to make sure that pointing is being reinforced on the weekends? And let's come up with a plan together. And then hopefully dad joins in. Doesn't always happen though. So a lot of it will be like reteaching. You really are. A lot of the times you're reteaching things because it's not being implemented consistently. Another thing you can bring up to mom is, if it's not consistent, if it's inconsistent, it could end up increasing her tantrum behaviors, and it could make them last longer. It could intensify them, because interventions that are inconsistent can be extremely detrimental with problem behaviors. So,
If you have a parent like that as a supervisor, and if the other parent who's involved asks for the supervisor to speak to that other parent, is that liable? Are we able to explain to them, this is the reason why we need you to be involved?
So you'll have to look at like who has, if they have like the custody stuff, like what exactly is going on. But I talk to, the other half all the time, and sometimes it's just harder for them because they only have them on the weekends, or they only have them one day a week, and it's just easier to just give in than to put in that work for that one day a week. So it's hard to get that other parent involved when things like this are going on, and that becomes a barrier. And it's something that you can write in your report. You can make recommendations, you can make suggestions, but at some point it's out of your control, and that parent has to step up and be willing to do it. So I've had parents go back to court to make it mandatory for the parent to have ABA in their home, because it's their choice. If they don't want ABA in their home, they don't want ABA in their home. So sometimes they'll go back to court to make it mandatory. But then again, you're running into another barrier, because you're being forced into the home, and the dad or mom or whoever, is like, I didn't want you in the first place. So, it's hard when things like this are going on. So, and it happens a lot in our field because of the diagnosis and because of the stress that it causes. And so it's just something to be aware of, and to know that at this point, with mom going through the separation and everything, she could be depressed. We don't know from this information, but it's something to keep in the back of your mind. Or, if they have a really bad fight, mom and dad, and you get there and she's, you can just tell that there's something going on. A lot of the times you need to stop what it is that you're doing and just ask them, like, what's going on? You seem different today. It definitely affects the kids. So, for example, I have a kiddo. Mom was getting married again, and the soon-to-be stepdad just called off the wedding and said that he can't handle this anymore. So the kid ended up, and he's a older, higher functioning kiddo, and he internalized it. 2 days later, he got in a fist fight at school. So you have to be aware of what's going on outside of ABA, because when I got there and he told me he got suspended, what'd you get suspended for? Oh, I was mad and I just punched down, and there was a kid standing there and I accidentally hit him, but you never got to the root of the problem until the kid left, and I asked the mom, well, what's going on? Well, we just broke up. So it's this, outside thing that's happening that's affecting him internally, or even affecting mom internally. I'm sure she's upset about it, and it affects how she's dealing with him. So just important to be aware of those things. Okay. So we are selecting goals. So behaviors. If that's an area, these are just examples that you could do with this kiddo. So behaviors, mom said there was tantrums. So you would ask her, what does a tantrum look like? She says she falls to the floor, screams, kicks her legs, kicks her arms. If I get too close to her, she starts hitting me. She's going through the list of what it looks like. So now you are aware of what it looks like, so you know what to look for. There's some kids that their tantrum is just them sitting in the corner crying for 20 minutes. So you've got to be aware of what it looks like and what the parent perceives as a tantrum. You'll ask them how long a tantrum could last. Does it last for 2 minutes? Does it last for 20 minutes? Give me a range. What's the longest one that you've seen? What's the shortest one that you've seen? And again, this is all stuff that you can find in the FBA too, but it's always good to ask parents to see how aware they are of things. Because some parents will be like, I have no idea how long they last. I just kind of walk away and let them, go. So it's just important that you establish that parent-child relationship and interactions, and how the parent perceives these tantrums. You ask them for examples of when it occurs. So that this comes back to like ABC data. A lot of the times we write goals for parents to be able to take ABC data. What is happening as the antecedent? So what's happening before? What are you doing before, or what is the child doing before the behavior occurs? And they'll probably give you a couple scenarios. okay, so when the behavior happens, what is it? Oh, they start tantruming. And then the consequence. What do? You know, Jamie is tantruming, or Jamie's looking at a cookie pointing, and I tell her no. And then she falls to the floor and starts tantruming. So what do you do after she starts tantruming? Well, a lot of the times I give her the cookie. Okay, we're reinforcing that behavior. She's pointing at first. We're not giving her the cookie. If you're going to give her the cookie, you're going to give it to her when she points. Don't wait until that behavior is escalated. So, again, you would word that differently. You wouldn't say it that way to a parent, but you would, we know we're on the right track. Like, this is why tantrum, as professionals, we know this is why tantruming is occurring, because she wants a cookie and she gains access to the cookie when she tantrums. So then you'll do some, hypothesized functions, so access for that one. And then different strategies to use. So reinforcing appropriate behavior. She's pointing. Mom, she's pointing. If you're going to give her a cookie, now would be the time to give her a cookie. Or, could do like priming, with that, like before anything happens. We're not having cookies right now. Can't have any cookies, letting the child know, preparing them for it. Or if they get a cookie after dinner every single night and you don't have any cookies, start telling the child beforehand, we don't have any cookies tonight, I'm so sorry. You can talk about providing choices. Okay, no, you can't have the cookie, but you can have this brownie or, whatever else. So, or if you're looking for something healthier, a protein bar, granola bar. Granola bars are very popular. So you can use providing choices, pre-mac, priming. For those more experienced parents, DRA, differential reinforcement of appropriate behaviors. So she's pointing, give her the cookie, kind of stuff. So I want you guys to try the communication one. So we'll do it together. You guys don't have to write it down if you don't want to. But so for communication, so what does it look like? I wrote it out for you already. Jamie grunts, screams, and points for things she needs. So examples of when it occurs. Can someone give me an example of when this might occur?
Prior to dinner.
Mm-hmm. Prior to dinner, if she's hungry. Yeah.
Watching TV.
Mm-hmm. Toys.
Shower.
Probably the store.
Yeah.
Grocery store, toy store.
Yeah. Oh, parents always want you to go to grocery stores with them. Always, which is great because that's when it occurs. And you want them to tell you when it occurs. So if they're like, it happens every single day when I take her to the store and she's pointing and then she starts grunting and then she starts flailing her head back because she's in the seat in the cart and and you're like, okay, well, let's go to the store. It gives you opportunities of when it's happening so you can come at those times. PC, you can come when you want. It's not scheduled the same, necessarily it doesn't have to be scheduled the same day every week or every month. So asking for those those examples of when it happens. Hypothesized function.
Oh, access to tangibles?
Mm-hmm. Access. Yeah, depending on, so again, that would come back to the examples. So she says, so mom says, every time I tell her to put her shoes on, she starts screaming and flailing her body. And you say, okay, so what do you do if she doesn't want to put her shoes on and she starts doing that? I just pick her up and we just go, and she just doesn't put her shoes on. Okay, escape. So that's why you ask for those examples of when the behavior occurs. It will give you more background knowledge, and they may give you more information than what it was actually put into the FBA. So just important to ask. And then strategies to use. What are some strategies you can teach parents?
Well, pre-mac, if it's the shoe thing, okay, first we're going to put our shoes on and then we're going to I don't know, some type of reinforcement.
Yeah.
You can have your beads. Or
Yeah.
Also priming for sure.
Priming.
Like in 2 minutes, you're gonna put your shoes on.
Right. Priming.
You can
Timer.
provide choices too, because my son went through a period where he would only wear Converse.
Oh,
Nothing else. So
yeah.
he knows screen.
Uh-huh.
You wouldn't want them, so providing a choice. Which one? Pick one.
Yeah. Kids love to be independent. That they crave it. So a lot of the times, just providing a choice, they feel like they're choosing. You know, they're being independent. So the only choices they get are the ones that you're, presenting. A lot of the times, what ends up happening, and I talk to parents about this a lot with choice making, is they'll provide 2 options, and then the child's like, no, I want that over there, and the parent's like, fine. And it's like, no, those weren't your choices. You can only choose the choices that you present to them. If that's an option, you need to present it, because now they're controlling the situation. So, choice making can be, it's easy, but it can get kind of fuzzy for parents sometimes. So, what's nice too is once you figure out strategies to use for tantrums and for communication, you can choose the ones that overlap. So, if pre-MAC is overlapping with both of them, let's work on pre-MAC, because we can use it during her tantrums and we can use it for communication. Yeah. Any questions about any of those? No? Okay. So, step 3, define interventions. So which intervention you're choosing for tantrums, which intervention you're choosing for communication, and you will define that for parents, meaning you will explain it to them. Yes, we will do role play and all that fun stuff. Step 4 is you will train parents. What do you do while you're training parents? You want to remember what you do at this step?
You have to do it themselves.
And you're taking the data on them, right?
You don't take data on training yet.
Oh, role
You're
play.
training.
Role play.
Role playing is the step 3.
Step 3?
When you're defining the intervention.
Before they implement, no?
They implement and you're
And
providing
Reinforcement.
feedback immediately throughout the whole process. Okay, next one. Parent implements. What happens at this point?
This is when we take data.
PC is taking data.
Parents implement on their own.
Yes, parents implement on their own.
I have a question about that. What if you have such a huge caseload that you aren't able to see the parent with the child for multiple months in a row? You can only go during the mornings. Can I take data based on self-report?
You would put that into your report though. So if you, ideally you would be there while they're implementing it with the child at some point, because what parents report to us isn't always
Accurate.
Yeah. You can ask them to video if they're comfortable with that. Videoing themselves do it. My very first one-on-one case, I was doing PC2, which was ridiculous. And it wasn't with this company, it was with a different company. But I showed up and the parents were like, she tantrums for hours and all of this stuff. I didn't see any behaviors while I was there, even when I was doing PC, for 6 months. Didn't see anything. Nothing. And the parents were like, no, really, as soon as you walk out of that house and you take off, it's a tantrum. And so I finally asked parents, I was like, well, why don't you start videoing it? And they were like, oh, okay. So then they'd start videoing it. And then we started watching it. during PC sessions and be okay, this is what you could have done, or this is what you did well. And that's where I would take the PC data. And then, I mean, ideally you would be there though. At least once a month, it would be nice if you could see the parent with the child. But depending on their availability and your availability, that might not be possible. You can always talk to the supervisor and see if when they come out during sessions, if they're ever able to see any parent interactions, and maybe they can take some data for you. But yeah, if we never get to step 5 with them, we can do all the talking in the world, but if we don't know if they're really implementing it correctly, it'll reflect in the child's data though. Like if the child's behaviors aren't going down, there's something going on, whether it's them not implementing it appropriately or if it's the wrong intervention or whatever it is, you know, you'll be able to see it. So and it's important for the PCs to go through the monthly summaries as well. So I typically will try and leave the monthly summaries in the binder for the 6-month reporting period so the PCs can go back and look and see where the data is. Some supervisors take it, but you can always ask data at proof. They can always send you the summaries, or you can ask the therapist to send it to you at the end of the month because they have to send them into data anyways. Progress monitoring. Anyone?
So is this when you see if it's working, then if it's 80% or whatever, then you move on to another strategy or whatever, and if it's not, then you start back over?
So for parent implements, you're taking data, right?
Yeah.
And they start meeting it at 80%. Then you'll start going to progress monitoring, which is like generalization. So can they implement it in other areas?
Okay, so not just with food, but with potty too. Or
Yeah.
Okay.
Mm-hmm. Yeah. Or even like you can put the goal on maintenance. So every so often you check in, just like what we do with the kiddos goals, where you put them on maintenance and then once a month you take data on it, or you should be, just to check to make sure that the goal is being maintained.
Okay.
Teamwork. Again, I am restating what I already said, but please work as a team. You need to interact with each other and update progress. It happens on occasion where a PC is taken off a case or asked to be removed from a case and doesn't tell the supervisor. The supervisor needs to know. Just because you let the office know does not mean that the supervisor knows. So then the supervisor emails the PC, hey, how's it going? Oh, I haven't been on the case for 4 months. Oh, wow. So please communicate. Make sure you're communicating about strategies that you're using. You can always ask to observe one-on-one sessions. Communicate concerns that the parents are having to the supervisor. Sometimes the parents are more comfortable talking to you because the PC has more of an established relationship sometimes than what the supervisor does. Sometimes the supervisor comes in once a month or, so they have a better relationship with you. So sometimes the parents will be like, look, I'm having a really hard time with this one-on-one. Okay, ask them what the issues are, tell them that you will talk to the supervisor and have the supervisor contact them. It's important that whatever the parents are communicating, you're letting the supervisor know. So when the supervisor walks into the home, they're prepared and they're not trying to catch up on what is going on. Any questions? Concerns?
I have one question. How long do you stay on each step, like with the parent? So step 1, you're there for 1 session, 2 sessions. I know it varies, so it'll be different with every case, but approximately how quickly do you get to step 5?
It depends on the goal. So if you are teaching, so you've established the areas of need, step 1, you've gotten all the needs that the parents have and everything, and you're moving on to step 2 and you're talking about the intervention you're going to be implementing and all of that, and then you go to role playing and they're not quite getting the role playing, so you go back
to step 2.
right, and then you reteach it, and then you try step 3 again, and then they're doing great with role playing, so then you start implementing for them to watch, and you're like, you know, they're not really understanding the function of behavior, so go back to reteach. So it's quite, it depends on the family, to be honest. I mean, I have some parents where I ask them to implement something and they do it the next day, and it's like, you're amazing.
Okay.
And then you have some parents where, like the potty thing, where you are literally talking about it over and over and over at sessions, and it just isn't happening. So when you write your progress report, you write that in there. What's a barrier? We've been talking about potty training for 9 months, and parents are still not implementing. So it's, you kind of go with the pace. You can always start pushing parents a little bit, nudging them.
So there's no set time, like we're not going to get in trouble if. Do you know what I'm
so
saying?
you would just have to justify it in your report.
Okay.
So we've been working on priming for 3 months, and parents just are not getting it. So you just have to kind of justify it, and you can do it by taking data. To be honest, you know, like outside, if you're just observing, you can always just take, if they're just not at step 6 or step 5, or step 5 for taking data, you can just take a few quick notes of like, you know, and give scenarios where parents aren't using priming, and put that into your summary. It's kind of a case by case basis, but I don't know.